Another classic presentation for impaction colics, especially more distal ones, is that the horse will back up and push its rump against a wall or a fence. And I explain this as a desire for a counter pressure being applied when the obstruction pushes in the pelvic area. Regardless of what they look like, it's not fully understood how they happen, and in some instances we know that a horse may not have had enough to drink, but this old adage remains true that you can lead a horse to water and you can't make him drink. Because not every horse that gets dehydrated experiences an impaction, there must also be some sort of dysregulation of the peristalsis or a dysbiosis that occurs. Enterocolitis are an extreme form of luminal impaction and usually form around some sort of nidus or something indigestible like baling twine or a rock. The best way and chance to treat an impaction is by reversing whatever led to it. So hydrating the ingesta that got dehydrated or preventing any gut spasm if there was, maintaining a healthy gut environment. Some clinicians may also use fecal emulsifiers or laxatives to assist with this breakup of the impaction. The next major category of medical colic is a displacement. When the colon fills with gas and we see abnormal peristalsis and gut movement, the colon can float out of its normal position and get stuck where it doesn't belong. In mild cases, this can cause a kink in the colon, slowing the passage of ingesta and gas, causing more and more distension and pain. In the most severe cases, that colon can actually twist, fully obstructing the lumen and the blood supply. Colics that present with a more acute and violent colic, sometimes with rolling and kicking at their belly, biting at their flank, seem to be this displacement. It's as if they're saying it hurts right here. Treatments for this can be to keep them off feed so that no more food can get blocked in that intestine, or just hydrating it to help it move through. Because the gas buildup may be due to an obstruction or because the colon got kinked, secondary impactions can happen, so hydration is always important. Antispasmodics may actually be contraindicated in these cases because the displacement is to the right and there's a lot of gas, and that antispasmodic will make it worse. Some clinicians may still use the antispasmodics for their rectal examination because it gives them a better feel of the situation and more information during the rectal exam. Another treatment that might help is lunging to the left or to the right. But why to the left, do we say? Because the pelvic flexure is supposed to live on the left side of the abdomen, and the hope is that by moving it, we'll jiggle it back into proper position. A discussion on medical colics wouldn't be complete without addressing enterocolitis that might present as colics and then deviate into an endotoxic systemic crash. These medical conditions can sometimes fool us because of small intestinal ileus or a moderate persistent colic sign without overt diarrhea. The big difference is that the gut sounds are usually increased and may even be fluid sounding. There might be a fever or a drop in the white blood cell count. If you have it, now's the time to use your serum amyloid A, because a simple colic won't have an increase in serum amyloid A, but a colitis case can have values over 2,000 millimoles per liter. A reason to be cautious if we're suspicious of an enterocolitis is that they're often needing biosecurity measures to avoid the spread and contamination to the environment. Be mindful of a systemically ill horse with significant gastric reflux, because a proximal enteritis can be caused by Clostridium and might even be zoonotic. As you rehydrate these cases, that's often when you'll start seeing the diarrhea begin, so don't be surprised if they seem to get worse instead of better initially. The best treatment for them, regardless, is hydration, anti-inflammatories, and good solid nursing care. How severe and how intensive the care needs to be could be very different, and it's definitely worth having your nearest hospital or referral center on speed dial. So what if that colic that you were called out to doesn't quite fit with a mild or moderate colic?